So welcome to session number 2 in the series. What we're going to do today is kind of revisit some of the things that we did on the first session. Building up strength does require a little bit of repetition, so a couple of things that are quite similar and another bit that is new. Same as always, if anything doesn't feel good, feel free to skip that section, rest when you need to, and adapt by using cushions, seats, pillows to support your head, things like that. So to start with, you're going to find any comfortable seated, could be on a chair or kneeling position if you prefer. We're just going to bring the back a little bit taller there, so think of crown of the head growing up towards the ceiling. And then we're just going to start with some gentle shoulder rolls. If you're prone to subluxing in your shoulders, please keep these very small, but just taking a nice deep breath. Think of the rib cage kind of expanding out to the side, and then breathing out. A couple more breaths here. As I said, think of rib cage expanding. You can have your hands at the side of the rib cage if that's useful. And then we're going to move into those shoulder rolls. So deep breaths first, and then just bring the shoulders towards the ears, gently drawing them back. Try not to have too much tension in the shoulders here. You don't want to be kind of yanking them down or forcing them forwards. Just rolling gently. And we're just going to take 3. Deep breath first, 2, and 1. And then just keeping the shoulders relaxed down away from the ears. And from there, keeping the same position, as I said, fine being in a seat. I'm going to take a breath in. Think of drawing the belly button ever so slightly in towards your body. And then we're just going to lift the right arm. You're going to go just as far as you feel comfortable here. Placing it down, taking another breath, swapping sides to the left arm. Again, if you're prone to subluxing in the shoulders, or if you're hypermobile in the shoulders, maybe just keep it to about chest, shoulder height. If it feels okay for you individually, you might want to make it a little bit bigger, possibly even overhead. If you are going to increase that range of movement to be a little bit bigger, just be really, really careful that as you lift the arm, the shoulder isn't kind of going up with it. So the shoulder's kind of keeping that space between the shoulder, neck and ear. I'm just going to take 4, big or as small as you feel comfortable. 3, still doing those deep breaths. 2, and last one. Then I swap that to a bit of a side bend, so kind of coming over to the waist. You've got 2 options with how to do this, either placing the hands either side of your body. That applies even if you're on a seat or kneeling. If you want to make it a little bit more intense, you would have arm overhead. So you can choose. Think of that lengthy crown of the head to the ceiling. Take a breath. You're going to think of keeping the hips and the pelvis still. If it's useful, you could always have your hands on the hips. And then just stretching over to the side. Think of closing this gap between the armpit and the hip. Opening that gap. We go the other way. So as I said, if you want to make it a little bit bigger, the arm would go long. It'll feel a stronger stretch, but ultimately just do what suits you. If you have anything like scoliosis, please keep this range of movement quite small. You don't want to end up with a big, huge curve when you've already got a curve to your back. That's actually one of the issues I have. So just kind of going side to side, coming into a little bit of lateral flexion, side bending for your back. And we're just going to take 3, 2, and 1. And then the final section from here. Again, you can choose whether to cross arms over your chest, or if you prefer something slightly stronger, perhaps the arms out in front. Tall back. Just be careful you're not popping and sticking out the ribs there. So think of ribs over the belly, over the pelvis, otherwise a tall back. Breath in first, breath out. You're going to try and keep the hips, the pelvis really, really steady there. So you're twisting more from the mid to upper back. Now, just want you to be very careful if you have anything like slipping rib syndrome, so subluxing ribs. Please keep this range of movement super tiny like this. You don't want to have a really big twist into it because it can kind of cause a little bit of irritation sometimes for the rib cage. And this also applies if you have scoliosis affecting the mid or upper back, or if you're like me and you have thoracic endometriosis or diaphragm endometriosis. It doesn't always like that stretch and pull to the side, so you might want to make it just really, really tiny. And we're just going to take 3, deep breath, 2, and 1. And then from there, just in your own time, we're going to transition to lying down on your back. So just making sure you've got plenty of space around you. You're going to have feet about hip distance apart. If you want to, you can place a pillow, a cushion, a towel under your head. Arms are going to go to the side of the body. We're going to come next into a shoulder bridge, which is one of the moves we did last week. So arms stay relaxed and planted down. Take a deep breath. Imagine you're rolling the ball into the belly button. You're going to start articulating, controlling through the back, adding that small lift. So now I've got a tiny gap under the bum. I'm lifting through the lower back, mid-back. Now if that's not comfortable, you might find your range of movement is just a little sort of tilt through the pelvis and a mini lift. Doesn't really need to be very high. And if you don't want to lift at all, you could always do that kind of rock forward and back through the pelvis. So wherever you are, we're breathing out as we start to kind of work up, if you like. Wherever your sort of range of movement, we're planting the soles of the feet quite firm into the floor, kind of thinking of engaging and using the back of the leg muscles towards your glutes, your bum muscles, to lift you up. That applies whether you're just making that very small into a tilt, or whether you're lifting all the way up. We're breathing in as we lower down. If you can, try and take quite a deep breath. And then breathing out to lift. Nice and steady. Either just that sort of tilt, that rock sensation through the pelvis, or into a bridge. Taking a breath in as I lower down. I'm going to do 3. Just the tilt or full bridge. Nice and slowly coming down through the spine, one vertebrae at a time if you can, just so you're not kind of flopping and planting to the floor in one go. We're trying to sort of teach and encourage the body to control through the spine, slowly strengthen through the spine. And we'll just take a final one here, either just that rock of the pelvis or the bridge. And then once you are completely back down to the floor from wherever you've been there, just bringing the feet and the legs closer together, dropping the knees over to one side. You can always move the arms a bit further away from the body. Don't force that right over. For those of you with diaphragm, even back problems to an extent, but definitely diaphragm endometriosis doesn't really like this move. It's quite a strong pull. So it might be that you just allow the knees to just gently rock and kind of use the hand to stop it. And we'll try one the other direction. Again, don't force the knees over to the floor, they can just go to wherever feels comfortable. And we'll just take one more each direction. As the knees go left, sometimes it feels quite nice to look over the opposite shoulder. Slowly transitioning through the middle. And then just coming and relaxing from there. Okay, so we're going to be staying in this lying position. As I said, it's fine to have a towel, cushion, pillow under the head. If you need any extra support for the lower back, it might feel quite nice to have a folded up towel for support there. And then hands, arms wherever you're comfortable here. Hands on hips can be useful. I want you to make sure that your ribcage isn't sort of sticking out. So think of just drawing even the back of the ribcage down towards the floor, just to kind of soften it slightly. The belly button and your deep core muscles are almost drawn down as well. You shouldn't need to hold your breath. And then from there, so you can feel your core muscles doing something. Make sure it's not so tight that you need to hold your breath, okay? You take a deep breath, and I want you to push one foot to the floor as the opposite leg just lifts really, really slowly. And then all we're going to do is swap over. Deep breath. I don't want you to go any faster than this, because what we don't want to happen is the pelvis, the back to start kind of rocking and unstabilizing itself. If it's useful, it might even be good to have the hands around the hips. Not too bothered about how high you lift. I wouldn't go any higher than having the knee above the hip. Your focus is keeping this kind of engagement around the ribs. The ribs are kind of level with the belly towards the pelvis. We're breathing out as we lift up. As I'm moving throughout this lift and lower, I'm keeping that sensation of just slightly hollowing the belly button down. It's not crazy strong. I'm really trying to focus on staying stable, especially around this outer hip, as I said, through the pelvis. And we're just going to take 4. 3. Remember to make this a bit smaller if you need to. It could be really tiny like this. The last one. And rest it there. I want you to take maybe 10-20 seconds to pause. We're actually going to repeat. I'm going to give you options with the repeat to progress. If it doesn't feel strong enough to progress, it might be that you're quite happy where you are, but I'll give you alternatives. Okay, so reset yourself. Be careful the ribcage isn't sticking out almost. I think drawing the ribcage down to the floor, through the back of the ribcage, the belly hollows ever so slightly. Hands wherever is useful, perhaps side of the hips. We're keeping that stability through the pelvis. Take a breath. We'll lift one leg. Options. Could be you add a short stretch. So I've got the leg completely straight up to the ceiling. Be careful you don't go too fast. Take a breath first. We breathe out to even move the leg. Add a quick stretch. It might be you straighten the leg ever so slightly, but you don't go completely straight. So I'm looking at just changing the movement ever so slightly, only if it feels okay for you. If it's fine, and it's quite comfortable and you need a little bit more challenge, what you could do as an option is lift one leg, support that leg. Keep the core engaged, lift the other leg. Then we lower and lower. So, let me just run through that real quick. We continue moving left and right, either a small lift with the leg bent, a lift with almost a bit of a stretch down the back of the leg, so going into a straighter position, or a lift. If you're going for that lift, please make sure you've got a little bit of support using the hand around the back of the leg, keeping the core engaged. We would then lift the other leg and then tap it down and down. So any of those options, we're just going to repeat for around about another 4. 3. And then either one more each side or into this supported option. And then relax there. Might be you want to hug the knee in for a moment and then swap to the leg. Sometimes actually feels quite nice to hug both knees in, but that doesn't always feel good if you're a bit crampy around the pelvis, which actually I am today, so that wouldn't be my personal choice. Might be you just go back to a little sway side to side. Just want you to take a few deep breaths, whatever stretch you've chosen there, a few deep breaths. And then in your own time, we're going to transition and actually come to lying down on your front. So let me show you what we're going to go with here. So, not everybody's favourite position. A lot of people, especially if you're prone to lower back pain of any type, it's not the most comfortable. However, if it's a sort of bearable position to be in for you, it's quite good for starting to introduce some strengthening for the back. So it might be that this section isn't for you. If it is, we're just going to sort of introduce one single exercise here, or maybe two. Alrighty, so we're thinking about the vision being right down to the floor, and straight legs, the palms of the hands down to the floor, the arms are quite tucked into the body. And I want you to almost picture that you're pulling your belly button up away from the floor slightly, so your core has just got that little bit of engagement. And then from here, we're going to think about taking the mind to muscle connection, almost as if you're trying to tense down the back of that right leg without really squeezing it. And then we're just going to pull the right leg slightly away from the floor. Notice I've not gone too high here, because what you don't want to do is lose the top of the thigh and the hip connection from the floor. So if I was doing it like this, it would be too high and it starts to strain the back. Okay? You're welcome to have a towel or pillow supporting the forehead. We're breathing out, very small lift into the right leg. Lower down, we swap. Breathe out. We lift the left leg. Now if you're getting anything like cramp in your toes, you might have to tuck them and do it by leading with the heel. Please keep this incredibly small, so that it's not overtaken into your lower back. And if that's a bit too much, make it even tinier. You could even think about not moving, but just trying to take the concentration from the brain into engaging the back of the leg muscles. As I said, without really squeezing too tight. We're only going to go for 3, 2, and last one. And then we're going to keep the legs in that straight position and do a second part. So palms of the hands are down to the floor, about level with your face or slightly ahead, if that's more comfortable. I want you to think of drawing the shoulder blades down, or even the rib cage actually, down towards your bum. Take a breath. Think of your body being really long, as if someone's trying to stretch out your spine in position, so crown of the head almost lengthens away from you. And then as I pull the rib cage down towards bum, I'm just going to press into the forearm slightly, just for a tiny lift here. Slowly lower, take a breath. And we're only going to do another 5. So remember, think crown of the head is long, the body is nice and stretched in position. I'm almost trying to pull the belly button away from the floor. And I wouldn't go much higher than this. The risk of going too high in this is that you end up in this really long position and it kind of dumps a little bit into the lower back. So think long, shoulders and rib cage start sliding towards bum. A little support from the forearms and lower back down. And we'll just take 2. Last time. And then when you're ready, slowly rolling onto your side, and we're going to transition to seated position. Okay, so you could do this from sat down on the floor. You could do this sat, I've got a little box here. You could do it on a taller chair. I would recommend, if you're going to do it from a chair, have at least a sort of half hard surface. You don't want to be on something really squishy like a really soft sofa, because it'll probably take away from the exercise a little bit. A dining chair perhaps, as an example, or just sat on the floor if that's more comfortable for you. So, just turn around so you can see here. Feet are about hip distance apart. I'm just nice and tall in the back. That little sort of tuck and tilt through the pelvis that we've done lying down to start our bridge, that's where I want you to think about. Arms anywhere you're comfortable. Think of, be careful around where the rib cage is, so think of just drawing the rib cage as if you're corseting and controlling the rib cage in. Take a breath at that point, and then we're just going to kind of tuck and tilt slightly through the pelvis as if your belly button is slightly pulling into your body. And then we come back tall. Not so tall that you're popping out the ribs, okay? The ribs are almost sort of corseted together, sliding slightly down to the pelvis. What you don't want to do here is completely kind of collapse into it. So we're keeping a little bit of length in the back, a little bit of a sort of tuck and flexion, a little bit, ever so slight rounding in the lower back. And you're just drawing yourself slightly back, using around the front of your core. And we're just going to take 3 here. Nice deep breath. 2. And then next time you're in your back position, you decide how far back. That will probably be enough for me. You don't want it too intense that you start shaking or anything around the front of your belly. Arms, you might want to hold on for a bit more support. Take a breath here. I'm going to come back to this leg lift that we did on the floor a moment ago. It feels a little bit different from seated. I want you to almost picture that you're zipping up your core to lift the leg. I'm doing the same as before. I'm alternating left, right. You start getting any pain in the lower back, and we just come tall again. Reset. Maybe don't go too far back. You could even have a little bit of support behind the lower back, such as a cushion wedged right in towards your bum there. We're just going to take 3. 2. And a final one. And then just roll it forward. One final exercise. It might feel quite nice to just kind of let the legs drop wide for a moment there. Just be careful if you've got anything like hypermobility, air loss, down loss. You don't want to kind of spread too wide around the hips there, but something that just kind of relaxes you for a moment. Soles of the feet are going back to being flat on the floor there. Again, this is fine to do it from the floor if you prefer. You would just be here. You can choose what suits. Tiny little roll through the pelvis like we did. Really tiny. Let me show you where I come from. Here, control the ribs. Tiny lean back, it's not very big. You cross the arms over the chest. Take a breath. We're breathing out. And same as earlier, it's quite similar to what we did in the warm-up, we're just in a different position. And we've got the tiniest tiny lean back into the movement. Same as before, if you're prone to subluxing ribs, slipping ribs, or you have diaphragm or thoracic endometriosis, you might want to keep this range of movement a little bit smaller. We're breathing in through the middle, belly button slightly drawn in, breathing out to twist. We've only got 4, 3, 2, final time, and then relax there. A couple of quick stretches for you. You can do this from your seat or the floor. I personally prefer this from the floor. So we're just going to have one leg straight. This other leg can either stay bent here, or as long as you haven't got any problems with hypermobility, it can always kind of just sink out to the floor there. How wide you go with this straight leg, it's kind of up to you. You want to try and open yourself into a stretch without forcing the stretch. You don't necessarily need a big one. What you can think about is just growing a little bit taller in the back, possibly leaning further forward into the stretch. So I haven't quite got the foot directly ahead of me. I've got it angled slightly out to the side. And I'm thinking of reaching as an option if you want to make it stronger. You might not need to. Of reaching towards this foot. And we'll just hold there for about another 5. Alrighty, when you're ready, same stretch. Swapping legs. Remember, you can do this from your seat if you prefer. Starting tall. Remember, this non-stretching leg can always be here. If you need a little bit extra stretch, you can lean towards that long leg. And then from there, just easing yourself into any comfortable seated or kneeling position. And I'm just going to reconnect with those rolls of the shoulder. So sat on your chair, sat on the floor, kneeling on the floor, standing up even. Close your eyes if you want to. Hands could be on the rib cage. Deep breath. Feel the hands expand if you've got them on the rib cage. Just one more breath here. And then next time you exhale, You're just going to gently roll the shoulders. As I said before, don't force them right forward or right up or right back, just gentle. For 3, 2, and 1. And you can relax there. We are all finished. Hopefully some of that felt manageable, and well done, and see you again soon.